Well, on now to our big focus this evening, the fight against the COVID virus and the flattening of the curve. How soon before India starts winning this fight, and where are we in terms of a cure? Joining us now, Dr. Randeep Guleria, the Director of the All India Institute of Medical Sciences, someone playing a key role in attempting to keep us all safe. Dr. Guleria, thank you very much for joining us once again. A question being asked by so many across the country: how soon will India take to flatten the curve?
So in my mind, the curve is already flattened. The challenge is how long can we keep it in that manner and don't allow a spike to happen. And I think for that, there is a lot of involvement of every citizen in terms of his responsibility, even during the lockdown and post-lockdown, as far as social distancing, hand washing, wearing a mask is concerned. Because if we don't do that and there is a lot of movement, there could be a spike in the number of cases.
Dr. Guleria, why do you say that the curve has been flattened? Because though recoveries are very encouraging, and though the death toll is low compared to other countries, is it not premature to suggest that we are almost over the hill, because daily we are losing, because the number of cases daily is still quite substantive?
Yes, so I'm not saying that we're over the hill. What I'm trying to say is that we haven't had a spike as the other Western world has had in terms of the increase in number of cases or the shortening of the doubling time. But at the same time, the number of cases has not started coming down. So unless we start showing that trend, we cannot say that we're over the hill. But what I'm trying to say is that we haven't really reached a stage where we could say that there's a sharp increase in the number of cases and our doubling time is shortening, and we're going to have a huge number of cases in the next few days. What we really mean to say is that currently the number of cases which are gradually increasing are still in an acceptable range as far as our health resources are concerned, and we should be able to manage the number of cases that are coming right now. They're not that large, and if we continue in this manner, then it should be something that is acceptable to us. If the number of cases suddenly surges to a huge number and we have a large number of cases which start flooding our health facilities, then we will have a challenge, and we need to work on strategies to prevent that.
So, Doctor, when can the lockdown in Mumbai and Delhi realistically be lifted? There are some restrictions which have been lifted. People can go to shops, not in all areas. But that's not the lockdown per se. People still have to go back home and stay in their homes. So therefore, when do you realistically believe that the lockdown itself in India is going to end?
So if we are looking at the ending of a lockdown like it was in the pro-COVID-19 era, I don't think that's going to happen for a long period of time. We will have to have a lot of social restrictions, hand washing, wearing masks, and some degree of restraint in our activities for many months to come, because we know that this virus is not going to go away. It's going to be there for some time, and we know that the environment may change in terms of the monsoon months or during winter months, and therefore we need to be vigilant for many months, and therefore we have to change the way we are actually going about our daily life in terms of being able to take care that it does not spread to other people in the community. We become responsible citizens and take care as far as infection control is concerned.
So that in fact brings us to one of the questions also being asked. Isn't there a huge risk of asymptomatic infections which can actually take place as shops open up, as people try and get back to some sort of sense of normalcy?
That's true. We do know that there are significant number of individuals who have mild or asymptomatic illness and who would go around in the community and would be able to spread the disease. And that's why I said that we should have a strategy where we assume that everyone may be positive, and therefore we continue to have social distancing, hand washing, and the measures that we have in place right now. If we continue with that, the spike in number of cases will not happen, and we as a community would be able to control it. It's a tough task and a tough ask for the citizens to do, but like I said, this is how things would have to be for the next few months.
And so that is a point you mentioned twice now, and it's fascinating that you should say that. Are you suggesting that shops will be progressively opened up, but that people will go only to their shops, maybe a few more establishments might be opened up, but then they have to come back, so you won't be able to go for your daily walks. You will not be able to walk around your colony. Public transportation will remain locked down. Is that what's going to remain in place for the next several months?
So that is a decision which has to be taken looking at everything in mind, the health factors, the economic factors, and how people can travel from one place to the other, so that some degree of activities is restored. But it has to be done with social distancing and looking at how we can prevent this increase in infection and transmission of infection. So that type of strategy will have to be developed. And like I said, we will have a new normal in terms of our lifestyle for the next few months, even if we do have a graded lifting of the lockdown.
Doctor, the cure, a vaccine, do the vaccine trials in the UK and Germany give us hope?
Yes, so there are a number of vaccine trials being done. There are vaccine trials also being tried in India. I know of 2 Indian companies which are also working very hard on trying to develop a vaccine. There are more than 20 vaccine candidates which are being explored in different parts of the world. But it's important for us to understand that once you look at a vaccine candidate, you first look at it and develop that as in a laboratory condition. Subsequently, you would need to do some degree of human studies as far as its efficacy is concerned. Is the vaccine effective in producing good amount of antibodies or immunity in the individual? You will then have to do studies to see, is the vaccine safe? It doesn't really cause significant side effects because you're going to give it to healthy, normal people. And then thirdly, you will have to see where can we get industry to get into this and start mass production. If we calculate all of this, it will take more than 1 year, at least about 1 year to 18 months to really have a vaccine in the market. And that's why I think it's something which will take some time.
So we've got some questions which have come in on Facebook. This is a question from Mr. Arun Kapoor. He says, I'm 65 and I live alone. As and when the lockdown is relaxed, is it safe to let my household help come to work in my flat? What are the practical, sensible precautions one can take if one were to allow household help to come in to cook and clean, a senior citizen who obviously needs some sort of assistance? How would you answer this basic question?
So I think this is a very fundamental question, because senior citizens are at high risk and therefore they have to be careful. At the same time, it's essential to have someone to help them. This individual is living alone, so he needs to have good infection control measures as far as the help is concerned. Whenever he or she comes to the house, they should properly wash their hands. Probably they could keep the shoes outside and make sure that they could even wear a mask while they're inside. And then while be careful about the surfaces they touch, and that could be cleaned with an antiseptic condition. If they have any fever, flu-like syndrome, they should stay at home and not come at all. And social distancing in the house could also be maintained.
So doctor, here's a question from Michael, who asks, since most cases are asymptomatic, people don't have symptoms at all, so they don't get checked in many cases. This is correct. Is there a chance that people get this infection and recover with their own without even knowing that he is infected with corona? I asked you this last time, but people are asking the same question over and over again. Can you have COVID-19 and not know you have it?
Correct. So many individuals would be asymptomatic, or I would say would not even notice the symptoms that they have. So they may have a little bit of fever, throat irritation, mild body aches. They may just think this is seasonal, or this is something they've had because of the change of temperature or sleeping in the AC for a long time, and they will not have any significant complaints and will become all right in a very short period of time. Or they really may have no symptoms, yet they may have the infection. Their immunity would be good enough to take care of that infection, and they will be all right. And I'm sure we have a large number of such people in our population. At some point in time, when we do some degree of surveillance studies, we will actually find that there is a significant number of people who had mild infection, and that is why the overall mortality of this disease is going to be much less than what we're thinking right now.
Will the BCG vaccine merely boost immunity, or will it defeat COVID-19 altogether?
So first of all, the data from BCG vaccine needs to be validated. It's based on observational studies rather than actually a clinical trial. There is a plan to have clinical trials as a BCG booster in high risk groups or in the elderly to see whether it helps, but it's something which boosts your immunity. It's not an anti-COVID-19 medication. It helps to boost your immune system in a manner like most vaccines do, and thereby give you a stronger immunity to be able to fight COVID-19.
Is plasma therapy the most effective line of treatment at the moment? And can you share some details of these two individuals in Delhi who were administered plasma therapy? They seem to be getting better. They were in the ICU. Or any thoughts that you can share about this in terms of what has been achieved so far?
So I think it's important to understand that plasma therapy is something which is there for quite some time. It's not a new therapy. It's been there for quite some time, and it's almost 100 years old because it was used during the Spanish flu or the influenza pandemic in 1918 also. But the important thing to remember here is that the treatment itself you give plasma for people who's recovered into people who are sick right now. For COVID-19, there are small studies which show that it does help. Even the data from the patients from India do suggest that it may be helpful, but it's just one part of the treatment. These individuals have multiple other issues. You're just giving them some passive immunity by giving antibodies in their blood, which will help the body to fight against COVID-19. But these individuals have a lot of other things happening. They have what we call a cytokine storm. There's some degree of infarction or clotting in the lungs which happen where the lung and gets clotted. There are some individuals who have cardiac problems because of inflammation in the heart. And we're learning more and more about systemic effects that this virus can cause. So although plasma therapy is going to be useful, it's not the magic bullet, and it's not something which will make a dramatic difference unless we combine it with other treatment modalities.
A last question, Doctor. Mutations of the virus itself, if you are developing a vaccine now or looking at cures, then how much of a challenge are mutations, and what mutations exist in India in terms of numbers?
So this is a question which is going around with a lot of researchers. Is there mutation as far as the virus is concerned, and is the strain in India different from what is being seen in the Western world, and that's why we're getting less number of serious cases? And obviously, as you mentioned, what is the implication as far as the vaccine is concerned? Because if the virus mutates, then the efficacy of the vaccine obviously comes down because it's made against a particular strain, and that has to be really looked at. In my mind, we don't have enough data. There's still a lot of research going on as to how much the virus has mutated or whether it has mutated at all as far as the Indian strain is concerned. But this is a very important question because it has implication both in terms of clinical and in terms of vaccine development.
Dr. Randeep Guleria, always a pleasure to speak to you. I think the big takeaway for me personally is that going forward over the next few months, there's going to be a new normal. Whatever rules are changed by the government, it's not going to be back to what it was right away. Would you agree that it's going to be different?
I would totally agree.
Right. Dr. Guleria, thank you very much for joining us and sharing all of those details. Thanks very much indeed.